and welcome to the Cerini Nonprofit Leadership Podcast, where we explore strategies, insights, and stories that help nonprofits grow, serve, and lead with impact. I'm Ken Cerini, and today we're diving into a topic that is so critical to the communities we serve, rethinking support for people with disabilities. That's a big issue we're seeing out there, so it's really important. So joining me today is John McGuigan, Executive Director of People's Arc, an organization dedicated to creating meaningful opportunities and connections for people with disabilities. John, thank you for being here. So let's kind of dive into this and let's see where this goes. So I think I want to start off with, what does true belonging mean for the communities we serve beyond participation in programs or services? I mean, these individuals belong to programs, they come to program and everything else. But, it really should be more than that. It should be, that it's their place, that they truly belong and stuff. So what does that really mean in terms of, the people you serve?
Yeah, thank you for the question. Thanks for having me on the show too. Appreciate it, and appreciate you for everything you do for our community as well. Yeah, true belonging, right? I don't think that word means anything necessarily different for any kind of population of people, whether you're supporting people with developmental disabilities or people with mental health challenges, whatever it is. We all really need the same kind of social determinants of health. We need access to relationships. And I think that's an area where people specifically with developmental disabilities have a very hard time. Our entire industry is designed through the lens of services and programs. And as a result, all of the measures, all of the things that you think about in terms of what that service looks like doesn't take into consideration relationships. So we've come upon this idea of the people's arc, and we're wrestling with it. We're at the beginning of a very ambitious strategic plan to redefine that entire process and build programs that look at belonging. We all need the same things. We all need somebody to help us. We all need somebody to help us navigate our challenges. And it's an unfortunate reality that for people with developmental disabilities, they're often surrounded by paid employees whose job it is to help provide care for them, but often become the default group of people to help them through all of their life challenges. And I can't think of a worse existence than having all of the people in my inner circle and closest to me paid to be there rather than wanting to be there.
Welcome to my life.
Oh, that's very good. Yeah, very good. You gotta have a couple in there. You gotta have a couple of people that are there because they want to be there for you, Ken. I'm sure that's the truth.
So anyway, I mean, the unfortunate part or the difficult part here is that, you have a very structured environment that exists here in New York State with OPWDD. There are specific aspects of programming that need to take place here in the marketplace. So, how do you develop something that kind of meets the needs and programmatic aspects of what OPWD and SED and anybody else require, but do it in a way that, as you said, the prioritizes maybe that human connection or that individual being component of what you're looking at.
Yeah, so it's an and conversation, right? It's not an or. We've established as an industry, and we're, like you hinted at, we're a very regulated industry. So a lot of those regulations are centered around providing safety for the people we support. And I think as an industry, we've done a really nice job of that. I think that's baked into our everyday practices, making sure that the people we support are safe and are cared for. But the and part of that is, how do we push that further? There was a time in our history where providing services for people with developmental disabilities meant restricting their access to the community, warehousing them in large institutions. That's a history and a reality that is within my lifetime.
Yeah, I remember too. Yep.
It's not that long ago. It's kind of crazy to think. I mean, some of the large institutions didn't close down until the late 80s, early 90s. So that's in our rearview mirror. And then the thought of the prevailing wisdom of the day was get people into the community. And we've done a really nice job of that. But being in the community and providing services is great, but what is the value? So as we stand today, we're really good at bringing people to the service, providing the service, getting people to the activity, keeping people safe in those environments. And a lot of our measures are built around those needs. But how about we develop measures for the level of social connection? How about we develop measures based on the satisfaction that people have with the partnerships and the relationships that they have in their lives? Maybe I was born in the 70s, maybe it should have been the 60s. I'm a hippie at heart. People need to be loved. And there's a way to measure that by having conversations with people and asking them what they truly need and want from the relationships. That's where we can add measures to see if we're providing people with what they need.
So when we look at this, are you talking about maybe bringing people together and try to find ways that people can develop connections before we put them in a living arrangement where those connections then become people who they're friendly with or who have similar personalities or similarities so that they can generate those bonds and those relationships within their living environments instead of maybe having people of different age categories or different modalities or whatever, maybe put a bunch of people around the same age with similar interests and everything else. Is that even a possibility?
Yeah, I mean, and I think as an industry, we've had some success at looking at the homogeneity of the groups that we work with and trying to put people with those similar kind of characteristics together, like you said. But then it's a deeper dive into, okay, well, what does the individual in that environment want? What are they looking for? And then to make this really basic, like we're really good at taking people to the thing, right? We're real to the art class. We're great at taking people to the art class. There's the art class. We go, we produce a piece of art, and we walk away. And the unit of measurement is attendance at the art class, right? And that's great. There's value in that. But if you and I were to go to an art class, and unless we were budding artists, and that's what we wanted to do with our life, but if we were just attending as a social event, I think of these activities where you go and you drink wine and you paint something.
Yeah.
That's not about producing art. That's about a social interaction, and the measure of that was whether that was a successful night wouldn't have been the quality of the painting that you produced, because ultimately they all pretty much look the same. The measure of whether that
They
night,
all wind up in the same place too.
yes, exactly. Yeah, exactly. The measure of whether that night was successful, and it was whether you had a good time, or whether you had a laugh, or whether you made lunch date with the person who you really get along with at that group the next week. So you can, that's the unit of measurement. So applying that same kind of thought process to the people that we support, I think that's where the value is. And retraining our employees to think about, it's not my job to get you to the art class. It's not my job to get you to the event. It's my job to support you and help you maintain or develop the relationship that you want with the people who are also there around you, who critically are not paid employees.
So what do you see then as the barriers or what we need to do to get to where you ultimately see this?
I'm the barrier.
Okay.
We're all the barrier. I have a family member I have a brother-in-law with a developmental disability, and it is incredibly easy for me to slip into protection mode when I think about my family member who lives in a group home. It's very easy for me to forget everything that I know and have learned about what is best for the people that we support or what they're truly looking for, and go into protectionism mode. A lot of the families that we work with are wired the same way, risk aversion. From a industry point of view, you mentioned earlier how regulated we are. Yeah, it's dignity of risk is a buzzword in our industry, but it's something that very few organizations have truly wrestled with, and being able to come up with a tolerance to allowing the people that we support the dignity of risk of trying relationships and getting to know people and building networks of their own in communities, because the regulations kind of are hyper focused on safety and protection.
So how do we retrain families? How do we retrain staff? How do we retrain governmental policies to kind of make this work to get to a point where the focus is on the individual and not on the program.
Carefully, right? Definitely carefully, because when you are communicating with family members, oftentimes who've been cast in roles of protectors, it's been a lifetime of fulfilling that role to make sure that the people that are their family members are safe and are well cared for. So going about that in a way that honors and recognizes that this is an and conversation, not an or. We're not trying to put people in harm's way by pushing them into unsafe relationships. We're trying to find healthy, caring networks for people, as well as taking care of the health and safety aspects. And then really trying to train our employees how to have that relationship first focus, so they're looking at each opportunity as a chance to build. And for most of us, relationships are built over periods of time. And I mean all kinds of relationships when I say that: romantic, familial. For a lot of the people we support, and I'm sure a lot of people, myself included, could benefit from this too. Strengthening relationships that you already have with family members it could be a critical aspect of helping you live a more interdependent life, because that's the myth, right? Our industry promotes independence, and none of us are truly independent. Um, I needed help finding my sneakers to get ready for work this morning. I depended on somebody else in my family to help me get going. I don't live a truly independent life. The myth about independence isn't that you have to do things by yourself. It's that you do things on your terms.
Right. Right.
So creating relationships with family members, strengthening them, or finding romantic or familial or platonic relationships with the people that we support on their terms that benefits them is something that takes time to do. So introducing that concept to families and having them be part of the equation is probably the most successful route.
Yeah, I mean, the thing is, I mean, that's what families want for their children. That's what parents want for their children. They want their children to be successful. They want their children to be quote unquote independent. They want their children to have a life of their own and friends and everything else. Yet I agree with you. I think in the developmentally disabled world, there is that protection that kind of pops up, and it's like you can't go out there, you can't do this, and there's that sheltering that takes place, and it needs to again break down that barrier, break down that sheltering, and get to a point where the child is looked at like any other child.
Yeah. Yeah, definitely, and yeah, with maybe modifications along the way, right? Because there are some realities there that we need to attend to. We do need to keep an eye on keeping the everybody safe. Um, but when I think about what families are looking for, we meet a lot of families of teenage children with developmental disabilities, and there's often a reckoning or a wrestling that goes on around the mid early teens, when you're envisioning your child growing up and what is the future for them. Is it marriage? Is it a career? Is it all of those things? And then oftentimes people with children who have a developmental disability struggle to imagine those realities for their children, and with good reason sometimes. But that doesn't mean that there can't be a rich tapestry and network of relationships that those people can have on their terms, honoring the abilities that they have, uh, to help them live lives that are fulfilling to them in some way, shape, or form.
So you said that there needs to be a change in how the staff interact, how the volunteers interact. What does that change look like? How should the staff and volunteers be working differently? I know you said it's to try to help foster and develop those relationships, but in what way, what role do they play in that process?
Well, the first port is to understand what that person wants, um, and that can only be achieved by communicating with that person, whether it's talking to them about observing the relationship that they have, seeing how they respond to different environments, and different people, and then building a portfolio of what that person currently has and is interested in benefiting from. So even just starting by recognizing that your role is to understand what that person's social and emotional life looks like, what that person's relational life looks like, is something that's kind of different perspective for an organization to take. I don't think I've worked anywhere that has taken that approach, that that's our role, is to understand who this person is as a whole and what it is that they're looking for. And if you start there, then and you start having those conversations, many organizations in our space are really good at building relationships with other entities, other programs, other businesses. Um, so we're good at doing that, but to what end? If we understand what the people that we're working with really are looking for, then you have the pathway to connect people to relationships that might be beneficial for them.
So when we look at the tools that are going to be necessary to make this happen, is it really just people? Is there technology? Is there changing regulations? I mean, what are the vehicles that will kind of open this up so that it's not, one voice, one agency, one whatever, but it becomes now a tide that changes the direction of what this industry looks like?
Yeah, the technologies are interesting. You and I can grow up in a different era where making relationships was a lot more manual. And these days, the people rely on a host of technologies to help form relationships, whether they be dating apps or all kinds of social groups. Um, Using that technology to enhance relationships, I think, is something, again, I don't think many of the people that we support have been exposed to. So taking a lead in that area is something that we have an eye on, which requires potentially development of technologies or training of the people that we support to use existing technologies or applications that are already out there to help people be social.
When we talk in the nonprofit world, a lot of that discussion evolves around impact,
Mhm.
right? What's the impact we're having as an organization? So when we look at something like this, how do we measure impact? How do we measure quality? How do we measure success? Um, you know, on I guess both on a micro and a macro perspective.
Yeah, there've been attempts at this. The Commission on Quality Leadership, CQL, I'm getting that acronym right, came up with a personal outcomes measure tool, a POMS tool that has been very influential in our industry over the last decade or so, maybe even longer now, in terms of helping focus on what the people in our programs are really looking for and really want. But it's self-directed kind of services is an offshoot of that. So the focus being on the individual and what it is that they're looking for. Um, that hasn't, in my opinion, led to as much focus on the relationship side of things as I think could be done. And I think what our agency, our rebrand from AHRC Suffolk to the People's Arc of Suffolk, putting the people at the front of that sentence was kind of like the door opener to this way of thinking. This was more than a rebrand for us. It was a look at, okay, we put people at the start of the sentence, and what do we know about what all human beings want and need? If we go to our social determinants of health, if we go to our Maslow's hierarchy of needs, it's really that need to belong to a group of like-minded people who we feel care and affection for. So that's the direction that this is going in.
So when we lead, do we lead with the relationship? Do we lead with the activity of what someone's interested in? Do we lead with, what is it, or is it all of it?
All of it. I mean, we lead with the activity, hopefully that the person is interested in, with the understanding that the activity can be the ends in itself, but typically the end is the relationship gained by doing that activity. I think about, I have an image, I don't know why, of fly fishing right now. Fly fishing is a very solo activity. You're out there and you think of the tranquil. If fly fishing was your area, that was your idea that you were interested in, then that might be the end in and of itself. But for most people and most activities, it's the social component of it that adds value to the activity. So when we get better at training our employees to recognize the opportunities that come up within those activities to help people create connections, I think that'll be when we're taking really good strides towards bringing this vision to life.
Yeah, I think, a lot of times, I mean, with me or with anybody else, you start having a conversation about a topic that you're interested in, and all of a sudden, you get excited. The conversation becomes very, very different. It takes on a completely different tone. And you basically suck people in at times or push people away, either one. But, the point is, if you can find people who have the same interests, it tends to be a much deeper relationship, people that you wouldn't think putting together, but if they have a common interest, it kind of works.
And there's a visceral thing that happens when you've been part of those conversations, right? There's an invisible bond that you create with that person. There's a visceral internal feeling that you get when you truly connect with somebody. And I've seen that happen in a number of different ways. It's happened to me, and it's happened to me with people that have disabilities that don't communicate with words. I've found areas of interest. I've found things earlier in my career, working with young adults and finding things that we could bond on together that were, not immediately known to me. And then you feel that connection with that person, and that's a relationship in and of itself. It's different from what we might perceive to be traditional relationships, but a relationship nonetheless. And there's value and importance in that.
So what are you doing to try to identify those interests? What are you doing to try to identify kind of what makes each of the individuals you work with tick?
Yeah, we're developing interest inventories. We're developing training for our employees to be able to ask the questions or make the appropriate observations. And a lot of this comes down to exposure as well. A lot of, and this is an uncomfortable topic for many people in our industry too, but there is a incredibly high incidence of bowling activities involved in services for people with developmental disabilities, which has led me to, postulate that there's two possible beliefs that you can have here. One is that there is something inherent in people with developmental disabilities that precludes them to having a passion for bowling, which I don't believe. Or two, there's a lot of bowling activities because that's all of the exposure that people have had to social recreational outings. And it's that or nothing. So increasing our ability to expose people to things, trying different things is a key element of this too.
So you talked about an interest inventory. What is an interest inventory, and how do you develop one?
Uh, Communicating with the person who's receiving services, asking them what their interests are. If they're able to answer verbally, that's great. If they're able to be observed, trying different activities and see how they react to them, including the family members in those conversations, what has worked historically. We have a relatively non-culturally aware approach to working with the people that we support. And I remember a seminal moment very early in my career, working in a group home with some adults with on the autism spectrum. And there was a gentleman there whose family was from Peru. And were it not for us hiring a new employee of Peruvian descent who was playing some music on their Walkman at the time, that's how old I am. And the gentleman who had a Peruvian family had a noticeable reaction to hearing this song. And I don't know whether it was something that he had remembered from his childhood or the rhythms of that particular kind of music were just known to him. And he became animated, which was unusual, to hearing this music. So taking a deeper look into people's backgrounds and rich histories and whatever, experiences they may have had earlier on in their lives is something that I think we need to pay more attention to as well.
What level of buy-in have you had from the family so far there, where you've kind of brought this up to them and had those conversations?
Yeah, overwhelmingly positive. Um, but when you start talking about romantic relationships, when you talk about relationships in general, sometimes there's a preclusion for people to jump to the idea that you're talking about romantic relationships. And I mean, that is obviously a factor and a component of what we're thinking about, but only one component. And I think sometimes people can get a little squirrely around that topic. Uh, but other than that, people have been very positive. And I think that if you're taking the approach that you're interested in families' perspectives on this, you do well. From an employee perspective, I think from the conceptual standpoint, everybody is all in. But then when it comes to the point of changing habits and looking through things through a different lens, it's going to require a lot of training and a lot of patience on our part, because I think we've functioned as an industry and as an organization in that industry for a long time. And we've been trained to focus on things that have value, but we're trying to add and enhance that. So it's good. It's going to take time.
How about collaboration with other organizations? Have you started doing any sort of collaboration? Are you seeing maybe that there are other organizations similar to yours, or maybe even outside of the IDD population that make a good fit for something like this?
Absolutely. We're early in our genesis of this project, so I think our plan is to get a little further down the road. But we already have very strong relationships with the IDD providers in our area. We have strong relationships with non-IDD providers. Just a quick fun anecdote: we had applied for the Hauppauge Industrial Association Nonprofit Award a couple of years in a row. And last year we were a runner-up, and we're really honored by that. And this year we went and taking this new kind of approach and trying it out, we we had our self-advocates do the presentation. And we didn't script them. We just gave them some guidance on what HIA was looking for. And they wrote testimonies and did their own presentation on what it means to be working at an organization that is starting to think about relationships through the lens of the people who we support's experience. I mean, it makes sense, right? If that's your orientation, then why would I be standing up there as the CEO doing the presentation for this award? And we won it because there's that energy that you were talking about before when you created this. Wasn't done out of any kind of sympathy or any kind of paternalism. It was done out of, there's an energy then, an authenticity that was created by those self-advocates talking about their experience, public speaking in front of a panel of leaders from Hauppauge Industrial Association. And they won that award. They got up and did the acceptance speech at the Crest Hollow Country Club when the award ceremony was done, because that was their work. They created those relationships with that panel, and some of those people are still talking.
That's awesome. It's definitely awesome. How do you ensure the longevity of something like this? I mean, there's initiatives that happen all the time. People move down a path, and then it seems like it fizzles out a little bit and gets back to, same old, same old. So how do you get to a point where this becomes what permeates through the industry on a go-forward basis and really becomes the norm?
Yeah, definitely a huge challenge, right? Old habits die hard is the expression. Um, but my hope is that authentic relationships endure.
Right.
I think about my own relationships. I think about some of my friends. I have very close friends that I can, you have that friend in your life that you don't need to speak to for a certain period of time. And as soon as you connect with that person, you pick right back up where you left off. It's like no time has passed at all.
I'm glad you used the singular in that word. Yes, I do have that friend.
I also have that friend. And again, isn't that interesting, right? Like that's a really, that comment right there is intuitive of not everybody wants the same thing. I have a small, close network. I have friends who have large, expansive networks. what I want, what you want, it's different, right? I don't need that close friend in my life that I speak to daily, but there's an authenticity to the relationship I do have with my closest friend that allows us to pick up whenever. In order for somebody to help me create that, if I needed support, somebody would need to know that about me. Somebody would need to find that out. But to use the micro example of my relationship with my best friend, that relationship will endure. And it's my hope that in creating these real bonds between people, that regardless of cuts to our programs, regardless of challenges in the environment, those relationships in all of their weird and wonderful variety will endure once they're created.
Yeah. Yeah, this is incredible. This sounds like the direction that things should move in. You know, we're seeing it happen a little bit out there in some of the non-OPWD funded agencies that have maybe a little more flexibility to bring people together. So this is encouraging that this is the direction that things are moving in. So I'm really excited about, you know, what we talked about here today. And John, I totally appreciate you sharing with us.
Thanks for the opportunity to talk about it, Ken. Really appreciate it.
So unfortunately, we're out of time. So to our listeners, thank you for joining us today. If you're looking to rethink how your organization supports people with disabilities, we hope this conversation inspires you to put connection, belongings, and human relationships at the center of your mission. Don't forget to subscribe to the Cerini Nonprofit Leadership Podcast for more conversations with leaders who are shaping the future of the nonprofit sector. Until next time, keep your eyes on impact, and happy Thanksgiving, everyone.